Hello and welcome back. Welcome back to Diverse Conversations. This is Ashika Patel. Thank you very much for joining me once again for a continuation of our Canadian Pharmacy Innovator series. Today, it is a pleasure to introduce you to our guest of the episode, which is none other than Stacey D'Angelo. Stacey and I go a while back. We did our pharmacy school together, and it has always been incredible to see her take on these unique roles as a community pharmacist and take up these practices, which I really credit to her in terms of innovating within our profession when it comes to bringing new models, bringing new practices into community pharmacy. Stacey is a pharmacist and founder of Your Simple Health, where she helps people optimize, streamline, and reduce medication use. Her current work specializes in deprescribing, which she has been doing in various practice settings like long-term care and specialty compounding pharmacy since she became a pharmacist over a decade ago. She brings together her knowledge of medication, entrepreneurial spirit, and a passion for holistic care to this innovative practice. At Your Simple Health, Stacey helps people who are feeling overwhelmed or stuck on their medications and optimizes them, streamlines them, and helps reduce medication use. Her specialty is in deprescribing, especially in safely and effectively tapering people off medications that can cause withdrawal or rebound symptoms while working alongside their doctors and care team. To learn more about Stacey's work, please be sure to check out her website, which is www.simplehealthpharmacist.com. And also stay tuned as she will be joining us very soon to tell us about her journey in terms of how she got into this practice. But before we jump into the interview, please take a moment to like and subscribe below to make sure that we get your support in growing this channel and making sure that we're able to bring this content to you, for a next very long time to come. Thank you for your support and stay tuned. Welcome back. And now we have Stacey joining us. Stacey, thank you so much for making the time to be on this podcast.
Thank you so much for having me, Ashika. It's honestly an honor to be here.
You're very kind. As I was preparing for this conversation, I couldn't help but recall how long of a journey we share, from being in pharmacy school together at University of Waterloo. And it has been a pleasure seeing you grow and taking on all these innovative practices over the past decade. I mean, can't believe we have been out of school for 10 years. But at the same time, your work has always been very inspirational. And I was so excited when you said, yes, I will be on the podcast. I was like, oh, this is amazing, because I know you're onto something very fun and innovative at this present time as we speak. And I would love to hear it from you. If you could tell us, let's start off with your journey. What has been your journey like from pharmacy school to today, where you started Your Simple Health?
Yeah, well, definitely. Thank you so much for having me on. It's amazing to think back to, us going to school together back, starting in 2009, which is, almost 15 years ago at this point. So it's been a while, and, your career really does fly by, and it's been a pleasure to see you grow and really help the profession as well. So yes, definitely an honor to be here.
Thank you.
In terms of my professional journey, I've definitely taken a bit of a windy road, as I think a lot of pharmacists have. I actually started off my practice in long-term care as a clinical consultant. And when I kind of reflect back on that today, it really speaks to I was doing deprescribing work even at that time, fresh out of school. I think a lot of the long-term care pharmacists out there can really resonate that 90% of your recommendations are to get rid of a drug or reduce the dose in the elderly population. So that kind of sparked my career and really a clinical focus. But I really did miss the community in respect to interaction with patients. I miss that a lot in long-term care. You're really working with the healthcare team, but not as much one-on-one with the patient. So I decided after a couple of years to leave long-term care, and I knew I wanted to get into community, and I knew I had a bit of a entrepreneurial or business flair. I wanted to own my own pharmacy one day. So I actually decided to do relief. So I strictly did relief for a couple of years at community pharmacies around mostly Southwestern Ontario. But honestly, that was a great learning experience, because I was able to see many different pharmacies and how they practice, and the good and the bad, and really take hopefully the good with me into my own practice kind of moving forward. So that was kind of my next step. And eventually I kind of fulfilled that dream of owning my own pharmacy. I owned a specialty compounding pharmacy downtown Toronto, And we had a little bit of an innovative focus on integrative and holistic health. We also owned a clinic which provided multiple services, again, around that holistic kind of framework, naturopathic medicine, nutritionists. We had a nurse practitioner doing some cosmetic stuff,
Wow.
and really collaborative with the pharmacy. And so that was really fun and a really influential kind of path, a piece to my path. And yeah, now here today, I just recently started Your Simple Health, where I help people to optimize, streamline, and reduce medication use. And I work directly with patients in that setting.
That's amazing. Thank you very much for sharing that because, and every time I think about your career journey, I often always recall your feature on Pharmacy Practice and Business magazine as well. Let's not forget that was a beautiful and wonderful feature because I think that's where it really, like, I got to learn about your practice and like, the way you think innovatively. I'm kind of glad to see that you're now taking it a notch further and you're working directly with patients through Your Simple Health. And I know you kind of alluded to this as you were sharing your journey as a pharmacist and an entrepreneur now with your own startup in a very innovative space where you're working directly with patients. Like, what made you land on this idea and like kind of think of going in this direction? Because I know it's not easy trying to build this practice out of scratch. I would love to kind of hear what motivated you to get into the space and have the courage to follow it.
Yeah, thank you so much. And definitely you nailed it. It is not easy. And my business is very much in its infancy at this time. So there's definitely some challenges. I think we can touch on that a little bit later. But in terms of where the idea came from, I kind of briefly mentioned deprescribing in relation to long-term care. But I also think this will probably resonate with a lot of the compounders out there that while doing compounding pharmacy, I really started doing a lot more work with deprescribing in that what we see is that patients who are having difficulty coming off of a medication, typically that causes withdrawal, guidelines and recommendations on tapering down the dose, but that's not a one size fits all. And when people come upon difficulty getting off the drug, often they'll come to compounding to have more slower taper down off the medication, whether that's using a liquid or compounding smaller doses of the medications that are commercially available in a pill or a tablet. So because of that, these prescriptions were just coming to me. And, my values and the way I practice, I was trying to, work with patients to also address, what else in their life aside from the medication can set them up for success. So I think a good example that everyone can kind of resonate with is sleeping pills, right? You kind of start taking a sleeping pill, whether it's a benzodiazepine or some of the other sedatives like zopiclone, other medications like that. And maybe it's because you have a stressor in your life and you just can't sleep and you need the sleep to function during the day. So totally get it. But what happens if you're taking it regularly for a while is your body gets used to it and you actually can get either rebound symptoms or withdrawal once you're trying to come off the medication or stop it. So we're working with patients on tapering down the dose, also trying to, as much as I can, provide some lifestyle strategies and set them up for success on the outside of that. But a couple barriers that I found in community pharmacy trying to have this kind of consultations with patients is like the physical setting. Having patients have to come to the pharmacy and you have like 15 minutes, maybe 5 minutes, maybe less, while they're picking up a refill or on the phone. And it just the pressures of the actual work environment were really not conducive to be able to have more in-depth conversations. And one thing that I found tied to patient success was like being able to, number one, meet them where they're at. So be able to, if they need the help, not just like it's time for a refill, they have a question or need some guidance and know that you're there. The other factor is just providing that medical guidance. So we see a prescription for deprescribing, and lots of community pharmacists see this all the time. And it's like a specific schedule, but with each dose reduction, it's they may experience more symptoms or less symptoms, and it's what do they do in that moment? Okay, now I'm experiencing withdrawal symptoms. What do I do now? Do I go faster? Do I go slower? Is there maybe an OTC you can take in the meantime? Is there something else you can do? So I think it's just being able to provide those strategies when they need them.
Absolutely, absolutely. And I think what you're doing is you're really making it more patient-centered, right? Like where you are setting or helping the patient set the intention, because I think, and we know that that's so critical, right? In terms of achieving the success we want to see with the plans. We can create a most beautiful plan we can ever think of in terms of a medication taper down. But if the patient is not working with you, that's the plan's just never going to be followed. So I think you're really making this a patient-centered practice, and you rightly nailed it as you were telling us about this, where time is of essence, and community pharmacy we know has never been this busy as it has been today in the present time as we have this conversation. Like we're doing so much more in terms of our professional scope of practice expanding this that really restricts our time. So to have practitioners like yourself who are now kind of providing that added layer of be it the collaboration that they need, be it the guidance that they need or the recommendations, I think it's such a great service. So I guess, since you've started this practice, what are some highlights and achievements? I'm sure you have plenty to talk about in terms of, how you have impacted patient care in such a positive way. But if you have some examples that you wish to share with us.
Yeah, for sure. So a couple things come to mind. First of all, I just want to say you hit the nail on the head, and I think patient-centered just like totally captures it. And when you think about any service or product even that you're selling in a business context, it should be designed around what your patient, client, consumer needs, right? So it's rethinking kind of that structure. So thank you. I appreciate that. In thinking about kind of success stories and maybe situations that have really resonated with me, one of the first actually was a patient. So her story was pretty interesting. She, in her late 30s, had a hysterectomy. And so as a result of that, she was put into early menopause.
Right.
And shortly thereafter, she started getting insomnia. As a result of that, her doctor prescribed a sleeping pill. This kind of goes back to the example that I just shared. She was actually on prescription sedatives, Zopiclone, actually for over almost 30 years when she had come to me, and she had tried everything to get off the medication. She was also working with her doctor, and had tried many things and just still couldn't stop. So it took a while over the course of 6 months, actually working with this patient. We tapered her off very slowly. And again, just kind of worked on those other lifestyle things to set her up for success without the medications. And one thing that really struck me as we talked about, just not having time, one of the first sessions that we had worked together where we were addressing other lifestyle strategies. When you think about sleep, one of the first things I talked to her about, sleep hygiene.
Yes.
Right?
Yes.
She was actually, like, the look on her face, she had actually never been, a healthcare professional had never brought this forward to her. In her 30 years on a sleeping medication, she was surprised by some of these tips. And to be honest, at first, I wasn't even going to bother with the tips and going through this, because I'm like, this is old news. She's been on this for so long. But she hadn't heard some of those tips before. And so that was really a trigger for me to start at step one. This is really needed. It's really valuable, and it's important to do alongside. It's not just a taper, we need to do both hand in hand. So that was a really meaningful story to me. And it was just such a happy success story when she was able to kind of get off the medication.
That's amazing. And it's no small feat. Let me reassure you that, because, let's just start off with getting patients off sleeping aids. We know how difficult of a challenge that is, because to practice lifestyle modification takes a bit of time, right? As you get older, it's a lot more difficult to adopt new habits and keep them consistently at it. you kind of sharing that like the patient never heard about sleep hygiene before, even though I was kind of surprised, but at the same time I was not so surprised, because it's like, who really has the time to sit down with a patient in a pharmacy or in a clinic or somewhere to actually talk about this? Physicians are so busy. Community pharmacists are also very busy. So like, the expectation for them to do a thorough counseling is a little bit of a challenge, because they don't have the time to even, take out time for their patient if they want to do it. So this is great. And I'm sure, like, as you continue and build on your practice, you'll have many more of such stories. And we look forward to hearing about those successes, because I think that will really give us an opportunity as pharmacists to also, kind of figure out where exactly do we make our biggest impact? Is it with the dispensary or was it with our clinical practice? And I think when you are in a practice setting that you are in, I think that helps us build down that data, and, hopefully we'll learn some insights from that in the future, in the near future. As with any highlights or achievements, there's always challenges, especially with a startup that you're starting on such a niche area with really no precedent whatsoever. What were some challenges or barriers that you faced as you were starting up this practice, or as you grow it right now?
Yeah, for sure. I think one of the biggest barriers that I'm continuing to face, but also first and foremost with myself, was just the perception of what a pharmacist does and who we are as a profession and what we can do. And so I think I'm continuing to, create awareness around the services that I offer, but it started internally. And, I think a lot of us as pharmacists really see the profession as like community or hospital. And in this time, I think especially at this time, there is really opportunity to do more and really think outside the box in terms of the way we deliver pharmacy services and the way we are a pharmacist and what that means to us. So I think, yeah, first and foremost, barrier for me was really my professional identity and like really, I guess, solidifying that and being open to that and thinking about what it is I want to do and how I want to practice, and then taking that into a business idea and kind of rolling that forward. So I actually did work with a small group business coaching program, and that was really helpful for me for that piece, because it really did help me with that identity piece, and then taking that to a business idea that was, doable.
I agree. And I think I can relate to that to a certain extent. When you're trying to venture into new areas or new spaces which have not yet been explored, or, they're not explored to the capacity where they can become streamlined or mainstream, it's really that imposter syndrome really kicks into, because you're like, I wonder if I'm actually cut out to even provide these services, or am I the best person to provide these services? And then it's like, is this something that should I be doing or should I not be doing? And I think the regulatory framework sometimes really creates this box thinking for us. And, I think the coaching really helps to kind of step out of that box and try to think outside of the box as well. Thank you for sharing that. And since we're at it, I think, as I would love to kind of just, if you can just, for our viewers and our listeners, if we have any patients joining us on this conversation, would love to kind of hear just some services that you provide, so that if they wish to get in touch with you, just if you can kind of give a quick recap of that.
Yeah. Of course. So right now I kind of have two service offerings. The first is deprescribing coaching. So, the deprescribing that I've been talking about, that's when a medication has been identified, that patient is, ready and willing, and sometimes it's referral, sometimes it's not. But I work with them on a longer term basis, typically 3+ months, to slowly taper the medication and work through, those guidance throughout the tapering process. The other one is what I call a targeted medication review, but really it's more of an in-depth medication management service. And it involves a couple consultations, which are an hour in length, and a really in-depth patient plan, and occasionally advocacy with their care providers, whether it's doctors, specialists, to kind of execute that plan that we came up with together. So those are the two main services. And yeah, I'm also working on launching a new service, which is a group program. I'm really excited about that. It's launching next month. Wow. So it's on deprescribing, but domperidone, used for lactation support. Yeah, so you may have heard about domperidone in the news lately.
Yes.
Health Canada is conducting a safety review about withdrawal.
Mm-hmm.
Um, and it's important to taper off the medication. So right now, I'm actually just launching this program to not just kind of help women with the prescribing of domperidone, but come together in a group setting to share experiences. I think this is a really good kind of group to share experiences in this setting and to gain from, each other and bring in some guest speakers. So yeah, I'm really excited about that.
That's incredible. Wow. Congratulations. And I look forward to, I guess, following you on your social media to get updates about these experiences as you start delivering these courses and these group programs. You're doing great in terms of even generating content on social media. I've been following, and I would urge everyone who's listening to also follow Stacey. We'll be linking all her social media handles in the description box below. So please feel free to follow her. Yes. And I would say follow her. Don't just think about it. Just follow her right now. Because she talks about some really good insights. And I think even as a healthcare provider, I really benefit from those reminders from time to time. So, it's always helpful and we are supporting our community. So why not? There's nothing better than doing that. But
Thank
Stacey,
you so
that's
much. I appreciate the shout out.
incredible. Oh, you're very welcome. And trust me, like this is, again, you amaze me with your out of box thinking. And this is exactly why I was so excited to have you on this podcast today. I think, as we are kind of switching gears on this conversation in terms of, you have had this entrepreneurial spirit where I know you have that innovative mindset where you come up with all these ideas, but I know it's never easy to do this all by yourself, and so how do you envision, as a profession, what kind of resources or what kind of supports would you have liked to kind of build this business up? I know one for sure, like this is the way I perceive our profession is, we may not have the most a lot of resources which would support innovative thinking and like trying to take chances and make mistakes, but having somebody who has already trialed and dabbled in so many different innovative practices, I would love to hear your take on this and kind of where we can do better as a profession to support each other.
Yeah, definitely. I hope that going forward in the near future, as I do think we'll continue to see more innovative pharmacy practice settings and environments, and people really thinking about patient care in a different way. I hope that our regulators and our associations really think about pharmacy practice without the bounds of the setting, because I know a lot speaks to community pharmacy and hospital pharmacy, and there's a few in between, long-term care, but really I think taking the lens off of like where you practice and just thinking about what the service is when we create things like regulations and stuff to enable a pharmacist scope of practice can really be beneficial in the long term to help enable these innovative practice settings. So I hope that we continue to see more of that. I know in every jurisdiction across Canada is a little bit different when it comes to this. Some provinces are even more restrictive than we have here. So yeah, I look forward to seeing more of that.
Absolutely, absolutely. And I agree with what you mentioned. I think it definitely needs to be more of the healthcare provider focus rather than the business focus. And I think there are two very different mindsets when you're looking at it, and two very different goals that we need to achieve with both of them. So definitely a point to be taken. And with that said, you had also kind of alluded to earlier in the conversation around, pharmacists taking on these new practices and innovating in terms of how we deliver this care to our patients. What kind of, how do you envision pharmacists taking up all this expanded scope of practices that's coming our way? And, how do we create this new practice and this new pharmacy community pharmacy identity, I would like to call it as that, because I feel like we're in kind of a revolutionary phase of really changing the way we are perceived by everyone, including ourselves.
Totally. I 100% agree, Aska. I feel like right now is a really a precipice for the profession and for a lot of industries and a lot of professions as well. But there are so many factors at play right now that are pushing pressure. And, I feel, unfortunately, I feel the commoditization of drugs and further pressure on that dispensing, I guess from a business standpoint, profitability of dispensing is going to continue. It's only going to continue to get worse. And, you and I graduated back in 2012, and we were amidst the white coat pickets in front of Queen's Park and all of that. And unfortunately, when I reflect on the last 10 years, nothing has changed. It's continued to put pressure, and I don't see that going away. And amidst of that, we've also seen a lot of burnout. I think post-pandemic, a lot of pharmacists are really, feeling the pressure of not only that push on the business, but also everything that pharmacists have shouldered over the past couple of years. And on the flip side to that, I definitely feel the public are starting to really value pharmacists. And, they've been front and center, and the only healthcare provider who's been there since day one throughout the pandemic, and only continued to increase value and scope in the services that they provide over the past couple of years. So I think those things combined, along with some like economic and other global factors like technology and just changes in consumerism and all of these different things, changes the way people access healthcare.
Right.
It's really like an interesting time to spur innovation and innovative services and businesses. So yeah, I'm excited for pharmacy in the next few years to see what comes of that.
That's amazing. And I think that kind of leads me right to my next question for you, which is, how do you describe the future of pharmacy in the next 5 years? I guess, we can talk about pharmacy and then pharmacist as well in the next 5 years. Like, where do you see us going?
Yeah, definitely. I think, I kind of just alluded to it with that. I definitely see pharmacy both from a business standpoint and a professional standpoint, really just like taking the reins by the horns when it comes to innovation. I don't think we have a choice at this point because of all of the pressures that we're experiencing economically, personally, from an HR perspective. Like, I think, as much as we can utilize technology and, pharmacy technicians and workflow changes and everything to enable better practices, I think it's going to really influence change in many factors over the next 5 years. So, and I think for the better. I think 5 to 10 years we're going to be in a better place than we are now.
Absolutely. I am certain. And you know what, I think that's what really excites me about these conversations I have with all my guests is the future of pharmacy, like with everyone that has come on this podcast, like it has been painted so bright. And I think it's also, the willingness to work towards that, right? By taking those chances like you did, or you are doing currently as we speak, because I'm sure it was not easy for you to, just start offering these services and charging patients directly. Like, I'm sure there was a hurdle to that as well. But you have taken that chance, and you're forging the path for the rest of us. So I thank you so much, for bringing this innovative mindset to our profession, and for taking the time today to have this conversation with me. I really enjoyed learning so much from you, like I always do. And thank you again for coming on this podcast and really sharing your journey. It was a pleasure to have you here, Stacey.
Well, thank you so much, Aska. Thank you for having me again. It's an honor. And also thank you for all the work you're doing and showcasing all of these amazing innovators within pharmacy and even healthcare globally. So it's been a pleasure to watch, and look forward to more.
Thank you so much. And with that, we're going to wrap up this conversation for today. Make sure, if you haven't already, follow Stacey on all her social media. They're linked below in the description box. And if you need to ever ask any questions to her, you can feel free to reach out to her, and also check out her website for yoursimplehealth.com, where she will have all the information in terms of how to get in touch with her. With that, we'll be signing off today, but stay tuned for next week for another episode. Take care. Bye-bye.
Thank you so much.